6 types of leaves that cleanse blood vessels and prevent stroke risk. Within our bodies, there are silent enemies that don't cause immediate pain or collapse us, but rather quietly and subtly bring about dangerous changes day by day. High blood fat is one of them. Though not noisy, high blood fat is a hidden culprit that contributes to stroke, myocardial infarction, and high blood pressure if not detected and addressed in time. The good news is that the solution doesn't always lie solely in prescriptions. Nature around us still offers familiar friends, sometimes just a few leaves in the kitchen or garden. Yet they contain the power to gently and benignly help the body regulate blood fat, making them very suitable for older adults. In this article, we will explore 6 common yet incredibly useful types of leaves. If used correctly, they can become silent allies for your cardiovascular health and blood circulation. And don't miss part 2, which will cover 7 early warning signs of fatty liver disease, an increasingly common condition that few pay attention to until it's too late. Part 1 to 6 types of leaves to cleanse blood fat. 1. Lotus leaf. Before reaching middle age, many people start to clearly feel that their bodies are no longer as smooth as before. They easily experience indigestion after eating, have restless sleep, or feel heavy and fatigued. This is not merely a sign of aging, but could also be an indication of silently increasing blood fat levels internally. For those who wish to find a natural, benign method to help regulate blood fat, lotus leaf is a worthwhile consideration. Not only common in daily life, lotus leaf has long been used in traditional Eastern medicine to clear heat, calm the nerves, and especially to help reduce fat. Modern research shows that lotus leaf contains natural active compounds capable of reducing fat absorption in the intestines, while promoting the elimination of bad fats from the blood, helping to cleanse blood vessels, improve circulation, and support the prevention of atherosclerosis. Additionally, lotus leaf helps relax the mind and supports sleep, making it very suitable for older adults who often have trouble sleeping. The method of use is very simple: daily. Just take 5 to 10 grams of dried lotus leaves, wash them, steep them with boiling water like tea, and drink it about 30 minutes after meals. The tea has a slightly bitter taste and a mild aroma, making it very easy to drink once you get used to it. However, individuals with low blood pressure or sensitive constitutions should start with small amounts and avoid drinking it on an empty stomach. Although it is a natural herb, lotus leaf needs to be used moderately, regularly, and combined with a healthy lifestyle to achieve the best effects. 2. Voy leaf, Cratoxylum formosum. If anyone has lived in the northern countryside, they would certainly be familiar with a warm pot of voy leaf tea every afternoon, accompanied by a few slices of boiled sweet potato or hot cassava cake. More than just a simple habit, voy leaf has long been present as a part of childhood memories, simple, rustic, yet containing a treasure trove of health benefits that few notice. According to traditional medicine, voy leaf has a slightly bitter taste and cooling properties, capable of clearing heat, strengthening the spleen, supporting digestion, and reducing feelings of bloating and indigestion, common symptoms in older adults, especially as digestive functions slow down over time. However, what has brought voy leaf attention recently is its role in supporting blood fat regulation, a benefit that modern scientists are increasingly interested in and researching more deeply. In the composition of voy leaf, scientists have found many beneficial biological compounds such as flavonoids, tannins, and especially beta-sitosterol, a substance capable of inhibiting the absorption of bad cholesterol directly from the intestines, while stimulating more effective lipid metabolism. In other words, voy leaf not only helps cleanse the blood flowing within the body but also supports the liver in processing fats, reducing the risk of fat accumulation and the formation of atherosclerotic plaques in blood vessel walls, the main cause of high blood pressure, stroke, or myocardial infarction. For middle-aged and elderly individuals, using voy leaf is both simple and easy to incorporate into daily life. Every morning, just take a handful of fresh voy leaves or 10 to 15 grams of dried voy leaves. Wash them, then boil them with about 1.5 to 2 liters of water for 15 minutes. Let it cool, and drink it gradually throughout the day instead of plain water. The voy leaf water has a slightly astringent taste and a mild aroma, It not only quenches thirst but also creates a feeling of lightness and freshness in the stomach, making it very suitable for use after meals or on hot summer days. Not only that, voy leaf water also helps stabilize blood sugar, supports anti-inflammation, and protects the liver, factors closely related to blood lipid disorders, especially for those with a weak digestive system or who experience bloating and slow digestion after meals. Maintaining the habit of drinking voy leaf water daily can significantly improve stomach comfort and overall well-being. However, we need to note that it is not advisable to drink voy leaf water that is too concentrated or to consume it on an empty stomach. As for some sensitive individuals, this may cause a slight gnawing sensation in the stomach. Moderately, in the correct dosage, and combined with a healthy diet, voy leaf can certainly become a silent yet effective companion on the journey to maintaining cardiovascular health and metabolism. 3. Green tea leaf. Besides its spiritual value, green tea is one of the types of leaves with the most powerful biological effects, especially in supporting blood fat control and protecting cardiovascular health. Many modern medical studies have shown that green tea contains a group of antioxidants called catechins, most notably epigallocatechin, an active compound capable of reducing fat absorption in the intestines, inhibiting fat accumulation in the liver, and simultaneously helping to lower triglyceride and cholesterol levels in the blood. Not only that, regular consumption of green tea also helps increase HDL, good cholesterol, which plays a role in cleansing blood vessels and reducing the risk of atherosclerosis. To brew green tea, you can wash the leaves with clean water or dilute salt water. Then cut them into pieces if they are too long. Gently crush the older leaves to help the beneficial compounds easily release during brewing. Put all ingredients, including the crushed older leaves, stems, and young buds, into a teapot. Pour boiling water over the leaves. Steep for a few minutes. Then discard the first infusion. This step helps clean the tea leaves, reduces bitterness, and removes any grassy taste. Pour more boiling water into the pot with the fresh green tea leaves. Cover, and continue to steep for 10 minutes. If desired, you can add ginger, pandan leaves, and lemongrass. After 10 minutes, pour the tea into a serving pitcher. Do not continue to steep the tea leaves in the water, as this will make the tea bitter and result in an unpleasant cooked flavor. When needed, you can add boiling water for a second or third infusion. Green tea should be consumed 30 to 60 minutes after meals to aid digestion, reduce blood fat, and provide a light, refreshing sensation. Most importantly, it is crucial to remember that while green tea is beneficial, it is not a magic cure. Its use must be combined with a healthy lifestyle, a balanced diet, and light daily exercise. When these elements are in place, a cup of tea not only helps cleanse the body but also contributes to maintaining a healthy circulatory system and a peaceful mind, truly embodying the ancient philosophy of those who live long and healthy lives. 4. Perilla leaf. Perilla leaf is commonly known as a popular herb in meals, but few realize that it is also a natural herb with the effect of supporting blood fat reduction, anti-inflammation, and effective blood vessel protection. For older adults, using perilla leaf correctly not only enhances the flavor of meals but also contributes to improving health indicators in a natural and benign way. According to traditional medicine, perilla leaf has a pungent taste and warm properties, often used to relieve colds, support digestion, and stimulate blood circulation. Meanwhile, modern medicine has analyzed and discovered that perilla leaf contains many plant-based omega-3 fatty acids along with antioxidant compounds such as polyphenols and flavonoids. These substances have the ability to reduce triglycerides, inhibit the formation of bad cholesterol, and thereby reduce the risk of atherosclerosis, high blood pressure, and cardiovascular complications. Furthermore, studies also show that perilla helps reduce inflammation in the body, a factor often associated with chronic diseases in older adults, especially vascular inflammation caused by high blood fat. Regular use of perilla leaf can bring dual benefits, supporting blood purification and strengthening immunity and natural anti-aging. The method of using perilla leaf is very simple. Daily, use about 1 handful of fresh perilla leaves. Wash them. Boil them with 1 liter of water for 10 to 15 minutes. Then let it cool and drink throughout the day. Perilla leaf water has a mild aroma and a slightly pungent taste, helping to warm the stomach and aid digestion, while also supporting blood fat reduction if used regularly every day. Additionally, perilla leaves can be used as a side dish in meals, or cooked in soup, or boiled, all of which bring health benefits. However, because perilla leaf has warm properties, people who are prone to internal heat or have high blood pressure should use it in moderation and avoid continuous overuse for a long period. 5. Bitter melon leaf. Bitter melon, or muap dang, has long been considered one of the precious medicinal foods in traditional medicine. Not only the fruit, but even the leaves of the bitter melon plant also offer many health benefits, especially in reducing blood fat, regulating blood sugar, and detoxifying the liver. Bitter melon leaves have cooling properties and a slightly bitter taste, with effects such as clearing heat, reducing inflammation, promoting bile flow, and supporting the elimination of toxins through the liver and kidneys. Modern medicine today has also researched and confirmed that bitter melon leaves contain active compounds such as triterpenes, polypeptides, and alkaloids, natural compounds capable of reducing triglyceride and bad cholesterol levels in the blood. At the same time, bitter melon leaves also help lower blood sugar, support liver function, and regulate fat metabolism, thereby contributing to improved cardiovascular health and reduced risk of chronic diseases. A study published in the Journal of Nutritional Medicine showed that extracts from bitter melon leaves had positive effects on lowering blood lipids and stabilizing blood glucose in people with metabolic syndrome, a condition common in individuals aged 50 and above. Older adults can use about 10 to 15 grams of fresh bitter melon leaves. Wash them thoroughly. Boil them with 1 liter of water for about 10 minutes. Then let it cool and drink it throughout the day like a refreshing drink. The slightly bitter, crisp taste of this leaf might be a bit challenging for some people initially. But with regular use, it will gently cleanse the body, reduce feelings of bloating and indigestion, and naturally support blood fat reduction. Additionally, bitter melon leaves can be combined with a few slices of fresh ginger or a few stevia leaves to make it more palatable, especially for those who are new to using it. However, individuals with low blood pressure or those taking medication for diabetes should consult their doctor before regular use, as bitter melon leaves can significantly lower blood sugar if used in high doses. 6. Exa den leaf, Celestris heinzii. Exa den is a type of Vietnamese traditional medicinal plant that grows abundantly in the northern mountainous regions of our country. It has long been used by ethnic minorities to treat liver diseases, detoxify, and support cancer prevention. Furthermore, one of the most notable benefits of Exa den leaves is their ability to help lower blood fat, stabilize blood pressure, and protect the cardiovascular system, which is especially essential for older adults. According to traditional medicine documents, Exa den leaves have a slightly bitter taste and cold properties, with effects such as clearing heat, detoxifying, reducing inflammation, and dissolving tumors. Modern medicine has also conducted in-depth research and discovered that Exa den leaves contain many precious active compounds such as flavonoids, saponins, triterpenoids, and quinones. These substances have strong antioxidant capabilities, cleansing free radicals in the blood, thereby helping to prevent blood vessel aging and limit the formation of atherosclerotic plaques. Notably, the flavonoid active compound in Exa den also helps reduce bad cholesterol and triglycerides, while enhancing liver function, supporting the liver in metabolizing fats and eliminating toxins from the body. As a result, Exa den leaves not only help regulate blood fat but also protect the liver, a key organ in lipid metabolism. For older adults, the best way to use Exa den leaves is to boil them for drinking daily. Use about 20 to 30 grams of dried Exa den leaves. Wash them thoroughly. Boil them with 1.5 liters of water for 15 to 20 minutes. Then let it cool and divide into multiple servings to drink throughout the day. The Exa den leaf water has a slightly astringent taste but is very easy to drink once accustomed to, providing a feeling of lightness in the stomach, liver coolness, and better sleep if used regularly. However, it should not be consumed too concentrated. And individuals undergoing special medical treatment or taking Western medicine should consult a doctor to avoid unwanted interactions. Dear esteemed audience, health is a precious asset. But it is also something easily lost if we do not pay attention to it. We hope this video has provided you with practical, easy to understand knowledge that can be applied immediately in daily life. Just by paying a little attention and slowing down a bit, we can certainly live a healthy and peaceful life with our children and grandchildren for a long time. If you find this content useful, please share it with your family and friends. And remember, your health is something no one else can take care of but yourself. Thank you for listening. Goodbye and see you again.